Here's a quick bare bones look at what makes a good chest radiograph. Look at both chest x-rays. What do you notice about them? Are there any issues that stand out? No issues, just two normal x-rays from two different patients. One difference is in the image quality in terms of the exposure. On the left image, there's more lung parenchyma visible, but the right has more clearly defined vertebral structures. So what do we look for in a good quality chest x-ray? First, we want to make sure we can see the entire thorax. That means most or all of the clavicles to the shoulder. Then, all of the ribs, starting from the neck in the first rib, all the way down to see the entire diaphragmatic domes and the costophrenic angles. Look at the clavicular heads and see that they're equidistant from the central spinous processes markings. If not, the patient's likely rotated. Here's a diagram showing the proper alignment of the clavicles to the spinous processes. The position of the patient relative to the detector or imaging plate is important. It is preferable to have the patient's chest closest to the detector. That means the X-ray source will project waves through the patient with the heart closest to the detector plate. This is a PA or posterior anterior view, and it's the most commonly seen. If a chest x-ray must be taken of a critically ill or immobile or unconscious patient, they must be imaged lying down, which would be an AP projection. As you can see in the diagram on the x-ray on the far right, the view has the heart farther away from the detector and it'll result in a much larger heart size on the x-ray image. Therefore, it's important to know what view you're looking at to determine if the heart size is normal or not. Another aspect is to ensure the image is captured when the patient is in full inspiration. Here we see the full inspiration on the left. The smaller image on the right is from a different patient at the point of expiration. Notice the number of ribs you can see in each image. On the side note, the metal hardware on the right is a spine fixation device. Here's an example taken from the same patient during inspiration on the left and on the right for expiration. The left image is more clear with better viewing of the contours of the heart and great vessels, as well as the lung parenchyma and pleural boundaries. On the expiration image to the right, we see fewer ribs, a higher diaphragm, poor visualization of lung bases, no costophrenic angles, and a heart that is obscured and difficult to find contours for. An image at an appropriate inspiration would show about 10 posterior ribs or 6 anterior ribs at the mid-clavicular line, and this can vary from person to person. So here we see all 12 ribs, but we really clearly see 10 above the diaphragm, and we can see these anterior ribs as they come around, so we can see where 6 and 7 would come along here on the mid-clavicular line. Now it's your turn. So pause here, practice counting posterior ribs, and then try counting the anterior ribs. To review these, the yellow numbers with the yellow dotted line indicate the anterior ribs at about the mid-clavicular line. The gray numbers on the posterior ribs, and on the right image with these purple and yellow are the anterior ribs. For the exposure or penetration of x-rays, we want to look at the lungs, that the lungs are not too dark or over-penetrated. An ideal image will show the bony structures behind the heart, including the vertebral bodies and ribs. This is a nice way to determine the level of exposure of an image. And that's it.